Look, hearing that your child needs a lumbar puncture, sometimes called a spinal tap, can be really worrying. And that's completely understandable. So, in this short guide, we're just going to walk through exactly what this procedure is, why it's so important, and maybe most importantly, how we keep your child safe and comfortable from the very beginning to the very end. So, let's start with the big picture here. When a child is sick, doctors are kind of like detectives trying to solve a puzzle. And sometimes the most important clues, they aren't in a normal blood test. They're hidden away in a very specific place. And that's exactly where a lumbar puncture comes in. So let's just jump right in. It's really easy to see this procedure as something scary, but a much better way to think of it is as a key, a powerful little tool that gives doctors the crystal clear answers they need to help your child get better. Okay, so what is it, really? At its core, a lumbar puncture, we often call it an LP for short, is a very precise and simple test. A doctor uses a very thin needle to collect just a tiny sample of a special fluid from your child's lower back. The words to really hang on to here are small sample and thin needle. And this fluid, what is it? Well, it's called cerebrospinal fluid, or CSF. Honestly, the easiest way to picture it is as the body's own natural bubble wrap. It's this clear, protective liquid that surrounds the brain and the spinal cord, just cushioning them and keeping them safe. So you might be wondering, why this specific test? Can't you just do a blood test? And that's a great question. The thing is, this fluid holds unique information that blood just doesn't have. It gives us a direct window into what's happening in the central nervous system. By analyzing that fluid, doctors can spot serious infections like meningitis or identify other neurological issues. And what that really means is they can choose the right treatment right away. I think we can all agree that the unknown is often the scariest part. So let's pull back the curtain and walk through the procedure itself, step by step. Knowing what to expect really can make a world of difference. First up, getting into the right position is super important. Your child will be helped to lie on their side, all curled up like a little bug or a cat, arching its back. This position is perfect because it gently opens up the spaces between the bones in the lower back. Next, the doctor carefully cleans the area. And finally, that thin needle is gently placed to collect just a few drops of fluid. That's it. And here's something that I think really helps put parents' minds at ease. The procedure itself is incredibly quick. We're talking from start to finish. The actual collection part usually only takes about 10 to 15 minutes. It's over before you know it. Now, I want to be really clear about this. Your child's comfort is absolutely the #1 priority. Before anything even starts, a local numbing medicine is applied right to the skin. And sometimes, especially with younger kids, a gentle sedation might be used just to help them stay calm and relaxed through the whole brief process. Okay, let's get to the questions that are probably swirling around in your head right now. And it's totally normal to have concerns, so let's just tackle them one by one. And this is the big one, right? The most important question on any parent's mind. Is it safe? And the answer, thankfully, is a very clear and confident yes. This is a very safe and common procedure. Here's why. And if you look at the diagram, it'll make perfect sense. The spinal cord itself actually ends much higher up in the back. The needle goes in way below that point, into an open area that's just filled with that fluid. Because of where it's done, there's just no risk of paralysis. All right, the next big question is about pain. Is this going to hurt my child? The team's goal is to make this as comfortable as possible. Thanks to that numbing medicine, most kids don't feel a sharp pain at all. What they usually report is a quick little pinch from the numbing medicine itself, and then just a feeling of pressure while the sample is collected. So the key feeling here really is pressure, not pain. Okay, so like with any medical procedure, it's important to talk about risks, but we need to put them into perspective. The most common side effects are pretty mild and they don't last long. Things like a headache or a little bit of back discomfort. As you can see, the more serious complications, like an infection or bleeding, they are extremely rare. All right, so the procedure's done. What happens next? Let's talk about recovery. And the good news is, it's usually really straightforward. After the test is over, your child will just need to rest for a little while, usually by lying flat. This just helps that tiny puncture spot heal up, and it lowers the chance of getting a headache. We'll also really encourage them to drink plenty of fluids. Honestly, rest and hydration, those are the two keys to a super smooth recovery. You know, after going through all the steps and the safety measures, it brings us back to that one big question. Why go through it? Well, it's because the value of getting a clear, definite answer is just immense.
I want you to just think about this for a second. A test that takes about 15 minutes can give doctors answers that completely get rid of any guesswork. It lets them start a precise, targeted treatment that can make a positive difference in your child's health for years to come.
You can almost think of it like this. Those few drops of fluid create an essential map for the doctors. It gives them the exact information they need to navigate your child's illness and guide them straight back to health. And if there's one thing I really want you to take away from all this, it's this. You are not going through this alone. You and your child have a whole medical team there to answer every single question, to ease your worries, and to support you every single step of the way.